So with this, we move to the last but very important presentation by Dr. Brenden Byrne. So, of course, we always keep important presentations in the end so that we can hold our audience together. So, Dr. Brenden has been a physician and a digital pioneer for the past 25 years and trained at Yale and McGill. He has had parallel career as an entrepreneur. So from his original practice in New Westminster, so Brenden created electronic medical record software and built a business that eventually was acquired by TELUS, if I'm spelling it right. So TELUS Health and currently serves over 50% of Canadian physicians. So from 2015 till 18, he served as the Chief Innovative Officer at this institution company. He currently sits on the boards of the BC Academic Health Sciences Network and the Institute for Precision Therapeutic Nutrition. So we are privileged to listen to Brenden about various approaches, particularly bringing the concept, talking about the promise and potential of type 2 diabetes reversal. So without wasting much time, I request Brenden to make the presentation.
Great. Thanks so much for the introduction. And if someone could give me a thumbs up to say where they can see my screen and hear me, I'm all good. All right, thanks so much. Really excited to do this talk. And really what I'm going to do is talk about kind of a view from the trenches, going kind of the front line. And I am presenting from the traditional unceded territory of the Semi-Amu people here in White Rock. Before I start, I'd like to start with a story. And I think it's so important that we always ground this in what happens to real people. So this is Don's story. So Don was a 57-year-old fellow that came to me with type 2 diabetes when I just opened my new practice. He was interested in a ketogenic diet to reverse his diabetes. So he had found some information online. He was very motivated. He came in kind of wanting to make change. When I looked at what was going on with Don, he had a 25-year history of diabetes. He was on insulin for 20 years, on an insulin pump for a number of years, taking greater than 200 units of insulin per day. Blood sugars were wildly out of control, and his pancreas was functioning at 11.7%. So, this really kind of challenged my thoughts, right? So he wants to reverse his diabetes. What is the conventional thought? So we've all seen this graph, right? Really what we see is increasing prevalence, increasing diagnosis of diabetes and prediabetes. So it's out of control. And this is true in Canada. It's also true in India. The conventional wisdom is that type 2 diabetes is chronic progressive disease. It can be slowed by vigorous use of lifestyle change and medications, but it eventually results in vascular damage and organ failure. Medical treatment, virtually no remission. So you look at the large studies here, spontaneous remission with current medical treatment is less than 1%. Over time, what we see is, for average age of diagnosis, 45. By 9 years, only 25% of people are on one medication. After 10 to 12 years, 50% of people require insulin. And so with this background, can type 2 diabetes really be reversed? This is where we have to ask this question. But we have some clues that yes, it can be. Our first clue is from bariatric surgery. Back in 1992, just after I finished my training, there were studies coming out showing that you could get 10-year remission rates of 90% with bariatric surgery. And this has been confirmed, and I think we land kind of somewhere between 60 and 70%, depending a little bit on the procedure in the study and duration of diabetes prior, can be reversed by bariatric surgery. The long-term remission correlates with the amount of fat loss, but you see immediate changes. This kind of information took Roy Taylor at Newcastle, and he really started to look at this. And this work, I invite everybody to have a look at. It's really kind of a tour de force. And what he went through is he defined this twin cycle theory, systematic proof everything from cell studies to primary care studies and back to bariatric surgery. And what he essentially showed was this, in this twin cycle theory, he explains what's going on. So, and what we see is, we see type 2 diabetes in a context of energy overload. So too many calories over time. Combine this with our muscles' inability to take up glucose from insulin resistance in our muscles. Combine this with our peripheral fat getting full. So we kind of gain weight and we start to get fat, our fat gets full and we start to spill over fat. And what happens is we drive liver fat and we start to present so much energy to the liver that gets turned into fat. But when this happens, the liver becomes less responsive to insulin, blood sugars go up, pancreas responds, and we see insulin levels go up. And when insulin levels go up, you need to understand that insulin is a storage hormone. So we actually gain weight and it becomes a vicious cycle. The liver, of course, tries to export this fat and we exports it in triglycerides, but those triglycerides end up in the pancreas and we start seeing pancreatic fat. And that pancreatic fat results in a decreased insulin secretion response and we get this twin cycle. So we get these two defects occurring. If we look at this a completely different way, what we see is, if we plot glucose versus insulin over time, what we see, here's your normal level of glucose. It's 5.5 millimoles per liter, which just, by the way, is the equivalent of 1 teaspoon of glucose circulating in our blood at one time. So in insulin resistance, as the fat builds up in the liver, what we see is this increasing level of insulin. And we see this increasing weight gain at this point in time. But note, the blood sugars are normal. So you go to your family doctor, you're not told that you're pre-diabetic. The only signs that you may have at that point might be an elevated triglyceride and, most importantly, an elevated waist circumference. At a certain point, the pancreas can't keep up. And at this point, we start to see the sugars go up. We call that pre-diabetes. We're 10 to 15 years into the journey at this point. And at this point, insulin levels are often 2 to 3 times normal with a 50% reduction in pancreatic beta cell function. We're well into this journey. We let this go further, we get to a diagnosis of diabetes, and often at this point, it's an 80% reduction of pancreatic beta cell function. So this is what we're seeing, is this twin cycle. The first phase of the cycle is insulin resistance driven by fat in the liver. The second part of the cycle is eventually the pancreas becomes affected. So if we want to stop this cycle, what Taylor showed is we've got to get rid of the liver fat. If we get rid of the liver fat, we restore insulin sensitivity and we can normalize fasting blood sugars. If we get rid of the pancreas fat, we can actually allow the pancreas to heal itself, pancreatic beta cells restore function, and we can normalize post-meal blood sugars. How much fat? Well, in their primary care study, Taylor and Dr. Mike Lean showed that if you can achieve significant weight loss, and I mean significant weight loss, so 86% of people in their study who lost greater than 15 kilograms were able to get into diabetes remission. Think about that, 86%. And when we look at it, how much fat is it? It's about 400 grams of fat that's in the liver that's driving this process. So it's literally like this pound of butter tucked under our right rib cage, but we have to lose a considerable amount of weight to get rid of that fat. More evidence has emerged from Virta Health and a ketogenic approach showing similar results and similar with a different approach. And most recently, what we've shown, kind of closing the circle on this, is there any difference between bypass surgery and just losing weight? And what we see is metabolic benefits of gastric bypass surgery and diet were similar and apparently related to weight loss with no evident clinically important effects that are independent of the weight loss. Or kind of put another way, it's kind of the weight loss, right? So we have to kind of have approaches to this. So we can answer, Don, we can say, yes, we can reverse the type 2 diabetes. So what we've done in our practice is we start to look at this and we said, okay, well, what's going on? What are the contributing factors to type 2 diabetes? And when you look at it, overwhelmingly, this is a lifestyle disease. And so we've developed a strategy we call 4+2 based on the principles of the twin cycle theory from Roy Taylor. And really, we break it down into some simple behaviors that we coach at a behavioral level. Eat in such a way that you can lower your insulin requirements. Use your muscles so that the muscles can be the glucose sink that they're designed to be. Make sure you're not doing other things that are adding fat to the liver. And all of those things lead us to a place where we can actually restore fat burning, and we have strategies for that. We can't forget the plus too. If you're stressed and if you're not sleeping, cortisol levels go up. Cortisol completely it provides resistance against insulin. So we've done, in our practice, what we do is we actually do a comprehensive lifestyle medicine assessment. So we look at everything. We do a 126 item questionnaire to assess person's lifestyle behaviors and symptoms. We give them an overall score. We look at behaviors. We look at symptoms. We use data design to provide context to people about what's going on with themselves. And we even actually map that twin cycle theory with their results. So you can see here, yellow or green is actually their own person result. And we educate them about what's going on. We then also use the data to provide feedback. So you can stand 10 feet away from this and see that somebody's improving, because you can see the colors changing from red to green. And this feedback is so important for people to realize that they have the power to change. So really what we're doing is we're creating these linkages between somebody's behaviors, what they're doing, somebody's symptoms, how they're feeling, and what their biology is saying to us through their lab results and through their body measurements. And that drives a behavior change process. And really what we try to do in our behavior change approach is shape it. So we look at 4 aspects to this: knowledge, skills, environment, and then application. The knowledge we largely treat through group medical visits. So we offer these 6-week free group medical programs. We teach them all about the twin cycle theory. And yes, we go down to the physiology and we actually teach them. Do they get it the first week? No. But by the end of the 6 weeks, they actually understand it. And in context of their lifestyle medicine assessment, they get where they are. We then shape the change through online coaching platforms. We have an app that we use to provide feedback where people can track. This feeds back to a provider dashboard so we can see where everybody is. And we start to shape the change. And when we look at the shaping the change, we have to recognize that when there's goals and strategies and actions, there's things that get in the way. So we have to remove barriers. We have to realign behaviors where there's wrong behaviors. And then we have to look at things that in context to understand, what are we competing against in terms of their own desire to reverse their diabetes? So going back to Don, what happened with Don? So we started him on 4+2 strategy, and it was remarkable. Within 3 weeks, we had reduced his insulin by 40%. In the first week, in fact, his blood sugars dropped from greater than 15 to virtually normal levels. His major symptom was chronic pain, limited activity. After 3 weeks, his chronic pain was gone. Basically, reducing the insulin levels actually took away a lot of his chronic pain. By 4 months, his hemoglobin A1C had come down to 6.5, which is very well controlled. Insulin was down to 60 units per day. But most interestingly, look at this, his pancreatic function had gone from 11% to 63% of normal. 25-pound weight loss, 3 pant sizes smaller. By 8 months, he was off insulin. His hemoglobin A1C is stable. C-peptide levels are not now high. He's going backwards on that curve that I showed you. Pancreatic function, 78% of normal, 70-pound weight loss. He's still on diabetic medications. He's still improving, but his life has been changed. And so what I challenge everybody here listening to this is, you've got to think differently than our current paradigms. Our current paradigms aren't working. So we've got to think differently. We've got to think prevention. But, as Mark said, we also have to think about reversal. It is possible. If Don can start to reverse this process to the extent that he's reversed it, given that history, many of our diabetics that are pre-diabetic or early diagnosis diabetics are absolutely reversible. So you can tell that I'm passionate about this, and I'd love to have some questions. You can reach out to me on Twitter. You can reach out to me by email. You can check out our website, and I'd be really delighted to take some questions right now.
Thank you, Brenden, for that great presentation. And as I'm supposed to be monitoring the chat room and things, I had to keep telling myself to keep an eye on that, because I just got so entrenched into your presentation. And other people were feeling the same way. And we've had a question if you're able to share your slides. So that was a question. As well, we had a question. that when you're going through this and you're helping and supporting your patients to do the reversal, what role do the family play or their supportive network in helping them through this, I guess, journey?
It's a huge role. So if you think about what's happening with any health condition, it's an interplay of your genetics, your own behaviors, but also your environment. And your family shapes the environment to a large extent. So you cannot take this outside of the context of the family. And so a lot of the change, when we're looking at the change, we actually can understand somebody's genetics without necessarily doing genetic testing, because we can actually see, based on behaviors and based on their biochemistry, we actually know how severe it is. So somebody with very good behaviors who has type 2 diabetes, obviously there's a genetic component to that. But we have to get down to that environment level to understand what's going on there. And that's a very culturally specific thing as well.
Yeah, thank you. And it's really like a great example of integrative medicine, in the context of what we're talking about today. And I have a question here from Vita. What are your thoughts on COVID-19 pandemic and how that influences our ability to think reversal, prevention, and thinking different to achieve integrative health?
What I saw during COVID was a divergence, right? I saw some people that did extremely well. I had people that used this as an opportunity to take control of their health, and they channeled their time and effort and their purpose into it. I had other people that it completely derailed them, and the social isolation, the various factors, their behaviors went in a completely opposite way. So again, it's one of the things that we teach in our program just around stress. It's the perception, right? It's how we perceive these things that matter so much. And I think that's what I saw so dramatically with COVID was there were different perceptions of the threat. There were different realities in terms of communities. Some communities were very hard hit. Some communities were less hard hit. And so, I think as we look at our whole system, trying to understand the equity or inequities between populations is super important.
Yeah, thank you very much. And I'll just highlight that we have our speakers here today giving you a little bit of the work that they're doing. And we do have follow-up longer discussions with the Harpreet Singh show, which will be coming up in July as well. So there will be more information on that. So we're at time, and Dr. Majunna, I will pass it back to you. Thank you very much, Brenden.
Thank you. Particularly, probably we had many more questions to discuss. So many you have answered all of them by telling that this is just like a trailer and the actual movie is coming soon. So probably that's what we have from each speaker to pick. Actually, there's so much of information. There's so many different approaches to pick. Particularly, I love one thing from Brendan's presentation, that he mentioned about vigorous use of lifestyle change. Because when we talk about lifestyle change, we don't bother about the dosage part of it. So when we talk about any other conventional medical approaches, dosage is given huge importance. But when we bring in other approaches like lifestyle medicine, we should know that you have owned a problem for last 15 years or 20 years, and you do need little more time. And at the same time, you have to work little more than a regular individual. So wonderful message. And it was a pleasure listening to all the speakers today, and particularly all of them bringing one message that integrative thinking is certainly needed,